Atherosclerosis. With a high blood pressure, the pressure on the vessel walls is greater than normal. As a result, the walls of the blood vessels can eventually be damaged. This process is called atherosclerosis, artery disease. Atherosclerosis often starts first in the smaller vessels of the body. If the vessels become damaged and narrow, it becomes more difficult for the heart to pump blood through the vessels. What medication is used to treat hypertension? The heart gets more to endure, and this can have consequences for the proper functioning of the heart. Increased blood pressure gives an increased risk of cardiovascular diseases, such as a heart attack or a stroke, in the long term. Kidney diseases, retina damage, and diseases of the urinary tract can also occur. How to prevent hypertensive crisis? What does hypertension medication do? 90 to 95% of patients with hypertension have primary or essential hypertension. The diagnosis of primary hypertension is often made when no clear cause for high blood pressure can be demonstrated. We speak of secondary hypertension if there is a cause for high blood pressure. The high blood pressure is then a consequence of an underlying condition, for example a kidney disease, a narrowing of a renal artery, or a disrupted action of one of the hormone glands. In general, the higher the blood pressure, the greater the chance of secondary hypertension. And the younger a person is, the more chance of secondary hypertension. Sometimes certain medicines such as the contraceptive pill, anti-inflammatory painkillers, corticosteroids, or antidepressants can cause high blood pressure. Pregnancy hypertension may occur during pregnancy. Genetic predisposition. There are known risk factors that can play a role in hypertension. In addition to hereditary predisposition, familial burden with cardiovascular diseases, this is a low birth weight, smoking, overweight, use of too much alcohol, sugar, and/or salt, too high a cholesterol level, lack of exercise and stress. Diabetes mellitus, diabetes, kidney disease, and pregnancy can also increase blood pressure. Increased blood pressure is rare in children. At young and middle age, more men than women suffer from high blood pressure. How to cure hypertension? What is pulmonary hypertension symptoms? High blood pressure rarely causes symptoms. Complaints that occur include headaches, especially in the morning, and mind. Dizziness, lightheadedness, and ringing in the ears also occur. An extremely high blood pressure, a hypertensive crisis, is often directly associated with headaches, shortness of breath, problems with vision and/or dizziness. Even though people generally do not notice a lot of hypertension, in the longer term high blood pressure is very harmful to the body. When in doubt, people are therefore advised to measure blood pressure, or have it measured. A preventive blood test can ensure that any disorders are brought to light at an early stage. How to treat hypertension? Hypertension cannot yet be cured, but good results are achieved with current treatments. The aim of the treatment is to reduce the high blood pressure to a normal level. This treatment can consist of adjustment of the lifestyle, healthier eating, losing weight, reduced alcohol consumption and smoking, whether or not combined with blood pressure lowering medication. These will usually be taken for a long time. CBD against cardiovascular disease. A recent study, published in June 2017 in JCI Insight, shows that cannabidiol, CBD, has the potential to lower systolic blood pressure in humans. The systolic blood pressure, upper pressure, is the pressure measured in the blood vessels when the heart contracts and blood pours into the body. According to the researchers, this finding suggests that cannabidiol, a non-psychoactive substance derived from cannabis and industrial hemp, can be used as a completely natural and non-addictive drug to treat various cardiovascular diseases. Clinical study. Scientists from the University of Nottingham in England found 9 healthy men willing to cooperate with this research. They received a single oral dose of 600 mg of CBD or a placebo version of this agent, after which its effect on their cardiovascular system was measured. The researchers monitored various cardiovascular parameters such as blood pressure, heart rate, stroke volume, how hard the heart pumps, and blood flow in the skin of the men, first in resting position as a frame of reference. Lower blood pressure. CBD significantly lowers systolic blood pressure, upper pressure, and stroke volume significantly, with increased heart rate, but unchanged output, the research authors report. This indicates that despite the lowering of blood pressure by taking CBD, the circulated amount of blood remains unchanged. Even with physical exertion, blood pressure remained low with CBD. Participants who took CBD had lower blood pressure, especially before and after stress, an increased heart rate, +10 bpm, a reduced stroke volume and decreased blood flow in the forearm skin in response to isometric strength training.